Hello, welcome to another Dr Foot video. In this video I'm going to talk about a case, a patient of mine who is a Sunday League footballer, loves to play football, and that's his real passion in life. He had an injury, and the injury he had was, as he was going to kick the ball, somebody came along, let me move this foot around, and kicked his foot down and forced his foot into that position. He was then getting pain on the back of his ankle joint, and before he came to see me, he went to see another couple of podiatrists who diagnosed mid-portion Achilles tendinopathy. They gave him the Alpha protocol, which is like eccentric exercises. One of them even gave him some like shockwave treatment, which is quite interesting because he didn't have Achilles tendinopathy. So what this gentleman had was a posterior ankle impingement, and I'm going to briefly go through it. It's often happened with soccer players and with ballet dancers actually, when they're on point for a little while. And the difference between posterior ankle impingement and a Achilles tendinopathy is the site of pain is different. It is a lot more deeper than Achilles tendinopathy, and if you know how to palpate the region, it's quite obvious. And sometimes it's more on the inside of the ankle than it is on the center of the Achilles. Now what we did for this patient is we sent off for some x-rays because I wanted to know what's going on, and look what we found. We found an extra piece of bone, which is the os trigonum, which occurs just there. Now, what happens is this piece of bone normally fuses as you get older, but some people it doesn't fuse, so you have this extra ossicle, this extra accessory bone. Quite a lot of people have it, but it doesn't cause pain in everybody. But if you're doing a repetitive motion like kicking the ball or doing ballet dancing, then it can lead to a problem. Now, the way we diagnosed this gentleman was with the x-ray and with a clinical test. So we have the patient lying flat on their stomach, and we forced the foot into this motion, and then I actually moved the big toe as well to further stress the tendon, which is the flexor hallucis longus tendon, which is why the gentleman was getting pain, because the FHL, which is the muscle, which is the tendon and the muscle which runs at the back of the ankle, was getting impinged. Now there's two reasons why this can happen. You can either have an accessory ossicle, or you can have an enlarged aspect of the talus, which is this bone here, which is called the Steider's process. Sometimes it's enlarged, and that can lead to a stenosing tenosynovitis. So basically the tendon gets squeezed a lot, and that causes a problem. This can normally be managed very well conservatively, which is what we did with this patient. We gave him some orthotics, we did some soft tissue work, I gave him a corticosteroid injection, quite local, just to ease down the symptoms, and he's gone back to playing football, and he's symptom free, which is great. He had to have a week or two off playing football as well, so I wanted to get some relative rest in that area, which was the hardest bit actually. It wasn't the hardest bit wasn't doing the injection and doing all the rest of the stuff. It was just trying to get him to stop playing football for 2 weeks. Very difficult. We are now going to work on some other structures also further up in the leg to give him some more stability, which may prevent this from happening again. However, the ossicle is still there, the accessory bone is still there, and in most cases this can be managed conservatively. In some rare cases you need surgery. I obviously do not do this surgery because I am not a podiatric surgeon. Didn't actually ever want to be a podiatric surgeon, but I would send a patient to one of my colleagues who is a podiatric surgeon that could remove it, but I've never had to send anybody, touch wood, yet to have surgery done. Hope you found this video interesting, and hope you found this case study interesting, and I shall speak to you soon. Take care. Bye.